like we have a quorum. So welcome to the joint meeting for the Rules and Open Government Committee and Committee of the Whole.
Yeah.
And Yasmin, can you take roll, please?
Davis,
Here.
Cohen,
Here.
Arenas, Morales,
Here.
and Jones.
Present.
Thank you.
All right, we're going to start out with the agenda for October 19th. And we are going to start on pages 4 and 5. Six and 7. Eight and 9. 10 and 11. 12 and 13. 14. And that's it. And when we come back to the committee, we also have an ad sheet, so the maker of the motion could include that. That'd be greatly appreciated. So we're going to go to the public. And Tessa, go ahead.
All right, so we're talking about the agenda for the next time, right?
That's correct.
Okay, so I get 2 minutes to talk about it. Well, the things that were on the agenda that I was shared with and looking at it that I was concerned about. One was about the airport, to give the Southwest, I think we're giving them some benefits or some, price reductions. And as a taxpayer, I do not want that to happen because of our climate crisis, that we shouldn't be supporting fossil fuel-based industries going forward. And that's that comment in regards to that we need to work on, reducing our fossil fuels to zero, and that, our planes are not flying without fossil fuels. So that's that issue. And in addition, there were issues about our COVID response and, our emergency response. And the thing is that we're not moving away from our COVID crisis because of our human behavior that is having us flying everywhere around the world. And this type of behavior is what's adding to our crisis of our COVID crisis, our health crisis. And the largest health crisis that the WHO is saying, the World Health Organization, is climate crisis. And so how we're going to cope. And I know we've been using that muscle with our COVID, but we have to use it better to cope. It's no longer can we reduce our climate crisis. We have to do that as well. But really coping with it is really our challenge now, is to cope with our climate crisis, and that creating resilient neighborhoods really has to be our focus. And how do we do that? We create food security and those type of issues by growing food locally. And that is where we need to change.
Thank you. Blair?
Hi, Blair Beekman here. Happy mid-October. You have issues of Southwest Airlines, and you have issues of COVID-19 prolonging the local emergency process. I hope I can speak a few words about the Southwest issues, if that's okay, this past weekend, to try to offer a bit of clarification. It's my understanding that the pilots walked out because of the issue of the vaccine mandate process that the owners of Southwest demanded on the pilots, and the pilots refused. I think this is a part of a series of what I've been trying to address to yourselves recently, that we have to continue the efforts to develop what is the vaccine process? What are we dealing with? What are we addressing? And how can we talk about it together more this fall? Well, it's good parts, it's bad parts, what can be flexibility ideas and practices. It's important stuff. The VTA is working on issues that I invite people to look into, that we have to consider that there is technology practices of this, that the purpose of open public policy ideas that I talk about can become incredibly important at this time and meaningful, and ways to create that good dialogue. We're trying to learn how to talk about these issues. So I hope that the open public policy stuff ideas I've been doing for years can really help out right now. And it's where all parts of the community can develop a more open, good, friendly dialogue this fall about open public policy practices, responsible, good guidelines, and this is how we work through this COVID era together. Thank you.
Thank you. Sandra?
Thank you so much for your time. I hope I'm reading this added agenda correctly, that we will be adding District 3 representative for the very important redistricting commission. I'm very concerned about the current maps that I've looked at, where San Jose State North and South Campus are being split. Negley Park and San Jose State North Campus is being moved to one group, and the other parts of San Jose State are in another district. This is a very large community. 33,000 students attend San Jose State. It's a major institution downtown. And splitting this, the way it currently proposed, but I'm looking at it, is splitting this community. It may not be a community that we think of in terms of race or ethnicity, but it is a community of similar people living together around the area. That area San Jose State has an impact on the area around it. We shouldn't be moving communities and not having the students represented, and such a large institution not represented as a whole. So I'm hoping the new District 3 representative will look at San Jose State as a community, and I'm looking forward to that being appointed so that that district can be represented again. Thank you very much, Raul Perez. I'm looking forward to a great candidate that you're going to suggest. Thank you so much for your time and for listening to my concerns.
Thank you. Bringing it back to the committee. I actually see Tony, you have your hand raised.
Yeah, I just want to say that the draft maps that have been released are first draft only. They're not approved. They're not close to being approved. The commission did send the consultants back to the drawing board. We have a commission meeting tomorrow night to discuss the second round of draft maps that we just posted. So I would encourage the person who's attending to go on our website and get the information for the redistricting commission tomorrow. We are still having multiple hearings every Thursday night at 7 p.m. throughout at least October and into November to have additional comments.
Thank you, Tony. Councilmember Perales.
Yeah, thank you. And we were unfortunate in that the person that had applied and been selected by to represent District 3 did resign. And so we've now been through the process of promoting and soliciting somebody to replace her. And I will say that we will have that selection in, and we'll make that appointment as the ad sheet says next week.
Great, thank you, Councilmember. Since you have the floor, or Councilmember Cohen.
I'll move with the agenda with the ad sheet.
I apologize. I didn't take that opportunity, Vice Mayor. I'll second.
Great, thank you. Yasmin?
Davis,
Yes.
Cohen,
Aye.
Cadenas,
Yes.
Perales,
Yes.
and Jones.
Aye.
Thank you.
All right. Next is the city council agenda for Tuesday, October 26th. And we are going to start out on pages 4 and 5. Six and 7. Eight and 9. 10 and 11. 12 and 13. And that is it. So I'm going to take it to the public, and Blair, go ahead.
Hi, Blair Beekman here. To comment on, there's some sort of continuing work on the Zoom hybrid meeting issues and questions. I hope this can be a time that I can ask questions about Zoom and, you know, the fact that this can be a part of the conversation this fall about how to better talk about COVID issues, and to make this an open conversation, to continue an open conversation. It's really important, and I guess we're starting to go through that now and understand that now, as I've been trying to say these words for the past few months. About the issues of subcommittee and the Zoom process, I've been learning
Blair,
that.
Blair,
Yes.
sorry for interrupting. Can you
Out
bring
of
it back
bounds.
to the agenda, please?
Okay. All right. I've got issues with that, but I will very much respect what you're asking at this time. And to
Okay.
go on to the encampment issues. Thank you, incredibly. My gosh, you know, the portable idea was brought here a couple weeks ago by Councilperson Mahan, that it was not very agreed upon and that we need to work with more established practices. That Mahan also mentioned himself, and one of those being, I think he was implying the idea of the encampment process. And lo and behold, here it is. You know, what is the future of the government-sponsored encampment process? It's an idea that's been practiced and studied for years. Boy, I really hope it's time we can do this and make real small homeless encampments around the city. People have been working on this issue for a long time, as part of an overall strategy how to work on homeless issues. I think it can be really good. I hope local neighborhoods will be wanting to look into it a bit more, and it's good practices. Thank you.
Thank you. Tessa?
Yes, in regards to the Zoom, you know, using our technology to encourage our democracy, this is very important. And so the whole Zoom technology needs to go on forever as we go forward, as, you know, community-based involvement is very critical. Like Matt Mahan has said, you know, that our solutions are going to come from the ground up. And so that's the people, and that, you know, all of our, you know, public comments and things like that are very critical to our, you know, solving the critical issues that we're facing. And we need the best minds to be put on that. And so therefore we need to, the biggest, you know, catchment of our public to get that kind of creative thinking and problem solving. So really want to support the Zoom, you know, technologies to create more democracy. And as best that we can improve that, you know, to make it as accessible as possible to all of us is really important. And then, you know, what we're talking about is using our technologies to increase our community engagement and our democratic principles. And that's why I was going to bring up the issues of our subcommittees, that they too should be open. And it's a very critical issue as we go forward, that these issues, you know, like I say, you know, our climate crisis we need to know, the future generations need to know what happened in terms of where we're going into our catastrophe that we're going into. So having our subcommittees to be open is very critical, as well as our Zoom meetings, that creates that openness of our democracy. And that's what I'm saying, is that our subcommittees have to have viewing into them, public engagement, either recording of the subcommittees so that we can know what happened. And like I say, future generations know what happened, because this is what they're going to be looking at, is the recording of what has happened.
Thank you, Tessa. All right, bringing it back to the committee.
Motion to approve. Second.
All right, been moved and seconded. Yasmin,
Davis,
Yes.
Cohen,
Aye.
Arenas,
Yes.
Morales,
Yes.
and Jones.
aye.
Thank you.
Thank you. So next up is the meeting schedule. And that is an overview of Senate Bill 9 and Senate Bill 10 and the implications to planning policy and zoning regulations study session. And the first public speaker is Tessa.
Yes, the whole issue of Senate Bill 9 and 10 that is trying to intensify our living environment is very critical to our survival. And so when we're fighting that, we really have to look at what is it that we're really fighting. And I think that, what impacts our community is noise and pollution, cars, and how they impact our neighborhood. They kill us, they pollute, and make noise. So the issues as we go forward, to say that 9 and 10, we need to fight that, I think is wrong, because we will have, my husband has been saying, as a climate scientist, we're going to have 40x more people in San Jose. That is, we have 1 million, there'll be 40 million, because of that, our lands are becoming uninhabitable around our own country, and there are no borders, and you don't need visas to travel within our country. So within our country, we're having so many uninhabitable spaces, the South, the North, everywhere, East. And so we know 40 million coming. This is our future, and we need to be preparing. So what we really need is government over business in regards to, we need government control to have quality of life. We need noise ordinances that are really enforced. We need our streets to become home zones so that cars aren't going down our streets. We really need to be putting our cars, we have to have, we should be building with no car infrastructure as we go into a more hyper local economy where all our needs are met locally. We don't need cars, and that's where we need to be going, and not to be fighting the densification of housing in our communities. So I think it is an ill path that we're fighting for that, but we need to create more.
Thank you. Sandra?
First, I want to thank the council very much for taking up looking at SB 9 and SB 10 and the implications on planning and zoning. I hope we'll all listen carefully, and I hope we all study well. I hope we'll listen to each other, both sides, so that we can come up with the very best for our city, and hope that we have lots of constructive input and wonderful questions from the council to the staff and to others that may be in attendance. So again, thank you for taking the time to do this, and thank you for your impartiality when you look at it and your critical questions that you'll need to be asking. Thank you very much.
Thank you. Bringing it back to the committee. Can I get a motion, please?
To approve the upcoming meeting on the 28th.
Second.
All right, we have a motion and a second. Yasmin?
Davis,
Yes.
Cohen,
Aye.
Arenas, Perales? Oh, thank you. Perales
Yes.
and Jones?
Yes. All right, motion passes. Next item is the public record. And the first speaker is Blair. Go ahead, Blair.
Hi, thank you. To speak to my own letter and to the letters about Vista Montana issues, my letter tries to summarize some of my feelings from the Rules and Open Government meeting a couple weeks ago with Councilperson Mahan and his housing ideas, portable housing ideas, among many ideas possible in housing at this time for a homeless community. I thought it was interesting efforts. It wasn't fully appreciated, and maybe it's a bit of an experience. I tried to offer suggestions of how to really rely on our practices we know well and what we do well at this time. And with so much subsidy funding coming in to use that money for in practice good terms of programs we already know, I think that can help things a lot. And from there, that's what is exciting. We can start to address more experimental ideas like the government-sponsored housing issues or encampment issues, and that I know Councilperson Perales is interested in as well. And he's been on this for a number of years too. So we're thinking of imaginative ideas. Thank you. And that comes to the government-sponsored safe parking programs at Vista Montana that I hope we can learn to work together, in the very least, maybe to develop a future notification process for future places for this, if this situation arises again. To have a notification process in place can be interesting, I think, for ourselves. Working on that can be interesting, and how to talk about these sort of issues. And to really remind again, there's certain fennel plants, I think, that Michelle Obama used to mention that can really help leach out the soil for arsenic and other poisons.
Thank you. Tessa?
Oh, thank you very much. Yes, so the Vista Montana issue is a very critical issue in our community. And because it really shows to light what we have been experiencing in my neighborhood as well, is the lack of communication from our government and its policies and its planning. You know, even in this case, it wasn't deep planning. It was so supposedly quote unquote emergency planning, but it needs the community engagement and the community outreach that wasn't experienced, and the frustration that these neighbors have been experiencing is the same frustration my neighbors have been experiencing in the Garden Alameda. And every time, like, I go to see Deb Davis or Raul Perales or Matt Mahan, they say, don't talk about 615. The reason we're having trouble with 615 is because it's putting commercial into our neighborhood, and we have been injured by the commercial in our neighborhood. And just like the Vista Montana is concerned about the injury to their community, you know, when you're doing these things to our community, which has already been injured, we're already a community at risk in terms of our pollution and the impacts in our neighborhood, the death and disability in our neighborhood. And then you put more commercial into our neighborhood, and you say it's good for the community, that it's you know, making money for the city coffers, but you did not communicate with our neighborhood. You did not tell our neighborhood that this is what your plan for our city is. That when, you know, and this is where we're having the breakdown. And I was thinking about, even with our, you know, redistricting, we really need most probably neighborhood districts. We need to become, you know, our neighborhood needs to become very viable about what we want in our neighborhood. And that was the movement of what the Villa Montana is saying. What do we want in our neighborhood? And how do we want it to go forward? And we do need to hyper-localize our government policies to be very hyper-local in terms of our neighborhoods. What do we want in our neighborhood? And it wasn't a hotel.
Thank you. That's it for public comments. I'm sorry, one more public comment. Gail, go ahead.
Hi, can you hear me?
Loud and clear.
Thank you very much. Thank you, Vice Chair. Anyway, I'm calling regarding the debacle and the mess that is going on at Vista, Montana, and reading some of these letters. as soon as we can, we need to take this whole property out of the housing department. People are getting broken into by other unhoused folks climbing over the fence. Nothing is being done. Nobody is taking care of. There's one person living out there. Um, I don't know if any of you know how much we're spending on this disaster. And I call it a disaster because it's going against the unhoused people. It's going to be for 9 months, $400,000. And there's one person living there. One person. The security guard that goes to sleeps. They've had break-ins. Nobody is contacting the residents of the RVs that got broken into. They have been broken into. Nobody's talked to them. It's a mess. There's no electricity. We need to do something. I mean, it's a wonderful program, but who's running it? It needs to get out of the hands because it's doing an injustice to the homeless. And I get calls all the time from folks, the unhoused, and they're disgusted with this whole thing. They want to move into their RVs, but 3 of them aren't livable because the city and Home First hasn't done anything about fixing them when they've been destroyed. They were destroyed at Component, and now 2 of them have been destroyed under safe parking at Vista, Montana. Thank you.
Thank you. Gary? Go ahead, Gary. Take yourself off mute and go ahead. Okay, we're not able to hear Gary, so we're going to bring it back to the committee. And Gary, we'll give you the opportunity to speak later on in the meeting if we can get you in. All right, bringing it back to the committee.
Motion to note and file.
Second.
Second.
All right, it's been moved and double seconded. Yasmin?
Davis,
Yes.
Cohen,
Aye.
Arenas,
Yes.
Morales,
Yes.
and Jones.
Yes.
Thank you.
Okay, on to the consent calendar. And I don't see any hands raised by the public. So we're
Move
going to close.
approval.
Second.
All right, it's been moved and seconded. Yasmin?
Davis,
Yes.
Cohen,
Aye.
Arenas,
Yes.
Morales,
Yes.
and Jones.
Yes. Okay, next item on the agenda is Assembly Bill 1400, Guaranteed Health Care for All. And I will go to the public first, and first speaker is Peter. Go ahead, Peter.
Hello, can you hear me?
Loud and clear.
Wonderful. Thank you, Honorable Vice Mayor and the Honorable Rules Committee. This is Peter Ortiz. I'm a trustee for the Santa Clara County Board of Education and community leader in District 5. I'm calling to speak in support of Councilmember Carrasco's memo for the council to build support for Assembly Bill 1400, the California Guaranteed Health Care for All Act. Currently, 3 million Californians have no health care coverage. Nearly 1/3 of the Californians who do have coverage have reported delaying or skipping necessary health care over the last year due to cost. And though conditions have improved because of the vaccine, the pandemic has ravaged the state of California, disproportionately infecting and killing working class families and people of color, especially killing residents of East San Jose. It is no secret that these communities were heavily impacted due to the decades of inequality and lack of access in healthcare. A single-payer system would enshrine healthcare as a human right in the state of California by guaranteeing comprehensive, high-quality care for all Californians while still retaining the freedom to choose who provides that healthcare, free at the point of service, and at a lower cost than the current system. The never-ending rising cost of employee healthcare adds challenges to our already strapped City of San Jose budget, costing over $100 million per year. Also, we've seen our small businesses struggle, which keep our communities thriving, but have suffered so much during the pandemic. They're struggling to afford healthcare for their employees. AB 1400 would dramatically reduce healthcare costs for most of these employers. I'm calling to humbly ask the Rules Committee to please support this memo and move the conversation to the entire council. Thank you.
Thank you. Email address starting with Bro Greg M.
Yes, this is Greg Miller, and I'm a retired registered nurse, and I worked as a hospital staff nurse for over 30 years, and I'm speaking in support of Councilmember Carrasco's memorandum for AB 1400. So I ask, why does this richest country in the world that spends by far the most on healthcare have the highest number of reported cases and deaths in the world from COVID? Why are our communities of color hit so much harder by COVID? A Families USA study in March of this year pointed out that 40% of COVID cases and 30% of COVID deaths were associated with the lack or inadequacy of access to health care. Assembly Bill 1400 would transform the current profit-driven system to one dedicated to restoring and improving health. I hope that the City of San Jose will consider joining Los Angeles, Oakland, San Francisco, Santa Barbara, and other California cities, as well as Santa Clara County, to call for a new system that puts the health of the people over profits and guarantees easy access to comprehensive health care to all California residents. The one that would be established by the Guaranteed Healthcare for All Act of 2021, CalCare, or AB 1400. Thank you very much.
Thank you. Connie?
Hi, my name is Connie Chu, and I retired from the County of Santa Clara earlier this year. I support healthcare for all. 3.2 million Californians have no form of health insurance. 2 million Californians can't afford to use their insurance because of costly co-pays and deductibles. The only way to guarantee care is for all to have a single payer system. Someone dear to me is in danger of losing medical insurance due to divorce. Her insurance has always been through her husband's employment because she has been a stay-at-home mom with 3 children. A divorce settlement might limit her coverage to only a couple of years. Please adopt a position of support of Councilmember Carrasco's memo to support AB 1400, the California Guaranteed Healthcare for All Act, also known as CalCare. Thank you so much.
Thank you. Tessa? Go ahead, Tessa. All right, we're going to go to the next public speaker, Bill. Go ahead, Bill. Take yourself off mute.
Can you hear me now?
Loud and clear.
Okay, great. Okay, this is Bill Wallace. I live in District 9, and I am a member of the California Alliance for Retired Americans. I have retired from the city of Santa Clara. I want to thank you for the opportunity to be able to speak in support of AB 1400. Since healthcare, in my mind, is a human right, we can no longer afford to withhold needed health care from the citizens of California. San Jose has always been a leader within the state of California, and this committee must lead the way by showing their support for health care for all. because healthcare is a human right. It is extremely important for the people of San Jose and for the people of California that this committee moves AB 1400 to the San Jose City Council for a vote of support. So when San Jose leads, we are all enriched. So I'm asking the committee to respectfully support this, support AB 1400 and send it to the committee for a vote. Thank you very much.
Thank you. Tessa?
Oh, thank you so much. Okay, good. Yeah. Well, I guess a couple of issues that, we're talking about healthcare. I totally support that the city council supports this AB 1400, whatever it is, and, as a universal healthcare. But what we really have to look at is the things that are causing us disease and work on preventing that. And I was just thinking about, somebody was speaking from the county school board. And in our neighborhood, District 6, we have a farmer's market that's not providing food stamps. That needs to change. Food is our medicine. And open air food markets need to be available to all, and they're not. And so that needs to be changed. We need to really make sure that our school at Lincoln High School, that is using public lands, is providing food stamp availability for all the people who need that, and that our farmers market is not. And it's a racist attitude, and this needs to be changed as soon as possible. And then I was thinking about our air pollution that also makes our disadvantaged communities vulnerable to pollution, which is the precursor, made COVID much worse. This is a respiratory illness. And so we need to be banning our gas leaf blowers immediately, and right now the state of California is going to give money back to, the low income landscapers only. So we need to ban it so that all our leaf blowers are banned. That needs to be across our whole city, as we are experiencing so much COVID problems. So that's that issue. And then the issue of cars, and I was thinking, how they're killing us, and that we need to, we need to ban cars on many roads, and so that we make a more livable neighborhood, because cars are causing so much.
Thank you. Mimi?
Hi, can you hear me?
Loud and clear.
Great. Thank you so much. Thank you so much for this opportunity, honorable council members. My name is Mimi Spreadbury, and I'm a part of Orchard City Indivisible. I am a constituent of District 2. It was very nice to see many council members at the Rose, White, and Blue block party, I suppose they did this year. So I am speaking to you, asking for your support, please, for AB 1400. Our healthcare system in this country and in our area was in dire straits before COVID. And I'm afraid COVID-19 really blew open all the inequalities within our healthcare system in our country, in our county, and in our town. And really the best thing we can do to help our communities of color and to help everybody is to support a single payer system for California. So AB 1400 is a guaranteed healthcare for All Act, which would enact a single payer healthcare program, CalCare, for all residents in the state of California. It would include medical, dental, hearing, vision, mental health, reproductive, and long-term care. Every person living in California would be included, regardless of income level, immigration status, prior health conditions, or ability to pay. Undocumented California residents would also be included. There would be no more in-network or out-of-network for providers. If you can see any doctor or hospital of your choice. And I recently had a family member, an older family member, that had to go to the ER, and luckily it turned out to be nothing of serious consequence, but she could not go to her hospital of choice, which was El Camino Hospital, because they're turning away ambulances at this time. So she had to go to Stanford Hospital, and she doesn't know if the doctors who saw her are in network yet. So please keep that consideration and approve AB 1400. Thank you very much.
Thank you. Blair?
Hi, Blair Beekman here. I just wanted to thank all the years of work people have been doing on this issue. You had a previous speaker, Greg Miller, from San Jose, who's been working, for a number of years on this issue. And then just a thank you to him and to all the efforts of people in San Jose that is finally happening, coming to fruition at the state level. And it's nice that Ashkara is working on it, and just good luck to everyone's efforts for this incredibly important issue. Thank you.
Thank you, Lucy. Go ahead, Lucy.
I'm having trouble getting Lucy to talk because she has an older version of Zoom, so it's not allowing her to speak for public comment.
Okay, let's go to the next person. Hopefully she can get it updated in time. Yusra? Go ahead.
Okay, can you hear me?
Loud and clear.
Excellent. Thank you so much for everyone here today. And I really appreciate all the speakers before me. I'm a physician practicing in the Bay Area. I reside in San Jose. And it is this year more than ever, it's been so clear that we really need, it's time for us to have a universal healthcare coverage. San Jose is one of the richest cities in the country, if not in the world, yet we have people who lack access to healthcare. As a practicing physician, I'm one of the few endangered species who have my own private practice. We really can't, unfortunately, a lot of doctors can't really do that because of the complexity of the healthcare system that we have today, and the way contracting with insurance companies and others make it so difficult for doctors to really be and run independent. So I consider myself lucky, as well as at the same time, having my own business. It's been very hard for me to get coverage for my own family, believe it or not, as a physician. And, so healthcare, AB 1400 bill will guarantee healthcare for all, will allow entrepreneurs, small businesses, physicians, you name it, people can practice however they want to. They will have the ability to keep their relationships with their doctors no matter where they are or where they are in terms of their career trajectories, and will allow people to choose the hospitals and the group of physicians that they wish to continue to practice with. I believe it will only enhance the practice of medicine. It will actually allow doctors to compete on best practices and not on which insurance paid the most. And in my opinion, it is really the right thing to do. This is
Thank you, Joan.
Can you hear me?
Loud and clear.
Okay, thank you. My name is Joan Simon. I am a proud member of the Santa Clara County Single Payer Healthcare Coalition and a member of the San Jose Peace and Justice Center. California Assembly Bill AB 1400 provides for guaranteed healthcare for all California residents. It would provide healthcare benefits that are comprehensive, covering all medically necessary health needs. These benefits would not only be available, but accessible to all, because Californians would not pay deductibles, co-pays, or co-insurance. The city of San Jose would see a reduction in expenses for negotiating and managing employee health plans. City employees would have 100% covered comprehensive health care for both full-time and part-time employees and their families. City employees would not have to face deductibles or co-pays when seeking health care, and they would not have to face the unpleasant complexity of choosing between different deductible amounts and employee contributions during enrollment periods. The right thing to do and the smart thing to do is to vote yes to move AB 1400 memo forward. Thank you.
Thank you. Brenda?
Hi, thank you. My name
Brenda.
is Brenda Sendejas. I'm a resident advocate of District 5. So, can Can you hear me?
Yeah, your connection is a little spotty. Keep going. Hopefully,
Okay, I'm sorry about that.
no worries.
Okay, so I just want to thank Councilwoman Carrasco, Assembly Member Ashkala, and the Single Payer Coalition for all your efforts and support for AB 14. We have a system that is highly dependent on inflation and prices, and with this COVID, we've seen our health deteriorated because of the lack of going out and the lack of preventative measures that we haven't been able to do due to COVID. I feel that this has been a really unfair system for everyone that can afford, and there's families that have to choose between keeping that extra $600 or getting healthcare for their family. And these are choices that we shouldn't have to be making. Healthcare should be something that everyone should be entitled to because this is our health. And a lot of times we don't prioritize it until we are sick, and we don't see or value it until we are in a hospital bed when it's too late. We shouldn't have to get to that point. We should be able to see a doctor and not worry about having to pay for it. I want to thank you guys for everything you do today, and everyone in the Healthcare Coalition. Thank you all for your efforts, and I'm just urging you guys to support this today. Thank you.
Thank you. That was the last public speaker, so I'm bringing it back. Well, before I bring it back to the committee, I see Councilmember Carrasco is prepared to speak to her memo. So, Councilmember Carrasco.
Oh, thank you, Chair. Thank you, Vice Mayor. And I'm not sure if you can hear me. I've got horrible connection today.
We can hear you loud and clear.
Okay, awesome. Well, I stand before the committee in the hopes that my council colleagues will approve AB 1400 to move forward to the rest of the city council. As you heard the other speakers who were so incredibly eloquent and passionate about making sure that all our residents are insured. And this is a big difference between being underinsured or not insured at all. So this is AB 1400 by Assembly Members Calvera, Lee, and Santiago. It's the Guaranteed Health for All Act. And I don't need to, let me see if I can put my video, sorry. Here we go, let's try. I don't need to remind all of you, we've been talking about it for the past 18 months. COVID-19, if there was ever a bright spot about COVID-19, it's just that it unveiled all of the inequities that we're living through in our communities. We know that in San Jose and in Santa Clara County, some of the hardest hit communities were on the east side of San Jose, 95127, 95122, 95116. These were communities that were also in the downtown area and part of Evergreen as well. And we know why. Part of it is that they were living in close quarters. They were our essential workers. Generations of underinvestment in these communities, and of course, a lack of access to quality health care pre-COVID. So all of this combined only added up to a disaster for our communities. So I stand before you in the hopes that you will consider supporting AB 1400. I want to truly extend my gratitude to the Assembly members, the co-authors of the bill, to the coalition that's been working so hard to educate all of us and make sure that this happens, and truly for all those advocates who are out there making sure that our residents can depend on a healthier system. We have a dysfunctional system where you heard some of the speakers say that over 3 million folks are not insured at all. And even those who are insured, about a third of them are unable to truly access the benefits of their insurance due to the high cost. I'll tell you a brief little story. Many of you know, I had the honor of standing bedside by both my mother and my father when they transitioned. My father died of complications of Alzheimer's, my mother of skin cancer. And at one point, my father was consuming 15 different medications on a daily basis. And October was our deadline. October, November, December, all their medication came out of my pocket. as a result, back in 2010, I had to file bankruptcy because the debt was just unsurmountable. And you know, I was one of those families that had to make a choice back then about keeping my little ones. I had 3 little ones and a young teenager, whether I kept them in their extracurricular activities. And truly, October through December, I had to pull Diego, Abby, and Paloma from gymnastics, from ballet classes, and from sports because I just could not afford, as an only child, to keep up with my parents' medication. This would allow families not to have to make those heart-wrenching choices and really set health as their priority. There are some things that we absolutely cannot control. COVID-19 was uncontrollable. It swooped down on us and it devastated our communities. But there are some things that we can control, and we can at least support a bill that is being considered in Sacramento with the hopes of ensuring our residents. The added benefit of this is that it allows us to also support small businesses who have been devastated by COVID-19, who are struggling to keep their employees, who are now letting go of employees. This is a new flock of uninsured employees that have never been in this situation. But AB 1400 allows us to support businesses by cutting down on the cost, by making sure that our residents are healthy, and by guaranteeing quality healthcare. So I just want to extend a USC study, if you'll grant me the moment. A USC study found that Latino immigrants of working age are 11 times more likely to die from COVID than US-born men and women who are not Latino. Our Latino residents have been our essential workers. They deserve to be taken care of and to have affordable healthcare. I'm sure that you all will agree. Lastly, there's a UCSF study that states that across all political spectrum, there is near consensus among economists that a single payer system would save money. I asked my council colleagues, I asked this committee to please forward this memo to the full council for discussion and potentially supporting it. I want to be part of that coalition in the state of California that's on board, and some folks have already mentioned it: San Francisco, Oakland, Los Angeles, Santa Barbara, Santa Cruz, Long Beach, Butte County, and our own Santa Clara County. I'm sure that you will agree that in supporting AB 1400 puts us on the right side of history. Thank you for your time.
Thank you, Council Member. I see that Lucy hopefully was able to upgrade her Zoom, so I'm going to give her an opportunity to speak. I see she has her hand raised. So Lucy, go ahead.
Hello, I'm Lucy. Can you hear me?
Loud and clear.
Hip, hip, hooray. Hi, thank you all so much for being here. And my name is Lucy Geaver, and I'm a member of the Santa Clara County Single Payer Healthcare Coalition. And I want to thank all of you for your service during this, especially during this COVID period. You have a really tough job. And thank you so much, Councilmember Carrasco and Assemblymember Colora, for really pushing this bill, for being champions. And I want to thank my own councilman from District 3, Raul Perales, who was with us from the start when we went and visited him back in February. I want to say we are all temporarily able-bodied. Healthcare is a human need. And in our system, too often, too many people face the financial hardships that Councilwoman Carrasco was just speaking about. And many go bankrupt. My own family has this story. I want California, the 5th largest economy on the entire planet, to take care of our business. And I want to make sure that everybody understands that in the state of California, 70% of every healthcare dollar that is spent comes from some government source already. And when we add the other money that's in the system, we can easily cover everybody comprehensively, and we'll have money left over. And just to touch again on the other side of the businesses, businesses don't go into business to be in the healthcare business, but that's what happens, especially for our small businesses who are trying to keep employees, from leaving to go to different jobs just because of health insurance. But they are in the business to make money and provide things that people want and need. And so we really need to stop, destroying and crushing our small businesses. There is a movie I highly recommend. It's called Fix It. Healthcare at the Tipping Point, and it is put out by a businessman who did a deep dive on this healthcare and his costs. Thank you so much, and please support AB 1400.
Great, thank you very much. So the next, bring it back to the committee, Councilmember Cohen.
Yeah, thank you. I'll be brief because we spoke about this once before this year. As a longtime supporter of single payer healthcare, I spoke extensively at the April rules meeting when this came forward about why this is important. And so I don't want to feel like we have to rehash, although we've also heard a lot from members of the public and from Councilmember Carrasco. This bill was held over for a second year, so we never brought it to council before, but the Rules Committee did approve moving this forward back at that time. So I'd like to move approval of this again and bring it to council in the near future so we can support it. Thank you.
Second.
All right, Councilmember Perales.
Yeah, thank you. Appreciate Councilmember Carrasco bringing this back up. I too was supportive of this as it came before us earlier, and considering it's now going to be coming into the new year, we'll be coming in just in a few months. Interested in obviously seeing how this is able to progress. I did have a question for Alex. I know you've joined us here. Did you have any other updates for us or in regards to the consideration or where AB 1400 is currently at?
Yes, thank you. Alexandria Felton, Intergovernmental Relations Officer at the City of San Jose. So as staff, we are reviewing AB 1400 and to understand the implications to the city. And we were also recently briefed by Assemblymember Culver's staff, and they provided more details on the status of the bill and some of the related advocacy activity. And so as others have mentioned, it is currently a 2-year bill. It was held earlier this year by the Assembly member. And because it was encountering some resistance within the legislature, which meant it couldn't be taken up again until 2022. And so a lot of or much of the resistance centered around concerns that the bill didn't include a funding mechanism. So the bill authors are hoping that it'll be heard in committee on January 22nd, and which is the reason why there's a lot of effort to rally support, because it must be taken up by a policy committee by the end of January in order to move forward. And so I know that the Assembly member and his team are ongoing, part of ongoing and evolving conversations on funding options. There currently aren't any details or provisions, additional details or provisions to kind of share at this time, but I think as staff, we're looking forward to seeing additional analysis on the cost and the the implications for the city. And I think that if it moves forward, we would be prepared to bring an additional analysis for to lend to that conversation at council if it moves forward out of the Rules Committee.
Okay, thank you. And I do think it will move out of this committee. So I do have an interest in some questions as you bring it forward, and I don't know if they'll be able to be answered just yet. In my reading of the language, I saw one area that I had of interest, which was if you were out of state, for instance, on vacation or something like that, and you're in need of medical care, what that looks like. And I see that there's some language in there in regards to a limited amount of time. I believe it was like 90 days if you're out of the area. I didn't see, and maybe I missed it, but in regards to things like retirement, that's one of the issues that comes up now with city employees, those that, say, for instance, have had Kaiser their entire career, and then when they retire, a lot of them are looking for areas in the country to move to that has Kaiser as a as a healthcare provider, because that's their coverage they have, and so they're looking for that and ultimately limited to that. I didn't see anything in there, and I don't know if you know offhand now. If not, that would be just one area I'd be interested in kind of hearing how they're dealing with that when you bring this back to the council.
Thank you, Councilmember. Yes, that's something that we can certainly look into and get those questions answered.
Okay, thank you.
Thank you. Councilmember Arenas.
Thank you, Chair. I want to first just thank all of the speakers for calling in and giving us their input and their insights in terms of how healthcare, if impacted or affects our lives and the lives of the people who are around us that we love. One of the things that and also let me not forget, Councilmember Carrasco, for bringing this forward. Thank you for bringing this forward and keeping our community at the focus and at the forefront. I know that you've been one of the, a huge advocate for our Latino community, especially during COVID, because they were the most impacted. There was a letter that came in, and it had some insight that I didn't have before, and I don't know how much of it is true, but this is according to MALDEF. And what they pointed out was that there has been a huge disinvestment in the Latino community, a systemic, as you know, we've seen in this county that the vaccine rates are not as high for our Latino community as they are for others. And there's something systemic, deep rooted in terms of that disservice. And our systems are now trying to fix for that, right? We're trying to have place-based strategies and language appropriate strategies to address some of those things. But I'm not sure, this is way beyond what we're responsible for here in our respective roles. But I can't help but think that what happens here at the county happens at a larger rate throughout California. And in that systemically, Latinos have been underserved, and that there might be Medi-Cal for our families, but there aren't any Medi-Cal providers that accept Medi-Cal for the particular field of expertise. And so I hope that maybe our IGR folks can bring in some of this analysis in terms of how would this address, we have a healthcare for all, obviously everybody's starting at the same rate, there is no distinction, but there has been some systemically some underserved populations, and there could be less offices in certain parts of town, less something or other that would impede healthcare for the most vulnerable, and especially for Latino communities and people of color. And so I don't know if that has been taken into consideration with this bill, and if IGR if there's anything that you can bring in terms of what MALDEF is stating that is one of their concerns. And I believe that there's a lawsuit ensued about this.
Thank you, Council Member. We can definitely look into that. I haven't seen anything in terms of connecting that correlation between place and health outcomes in regard to AB 1400. I mean, I'm aware that there is significant literature out there around that issue, but I mean, we can definitely look at that in regard and see if there's any analysis, or if it's something that the authors of the bill have considered in sort of drafting and developing the proposal.
Thank you, Alex. I just want to make sure that whatever we do and whatever we support, that we very consciously take a look at that system and try to address or undo, or at least identify what has systemically disadvantaged some communities versus others. And we're having these kinds of very concrete conversations in land use, but we're not having it in healthcare. We're dealing with it as we've gone through the testing, and we've gone through the vaccinations, and we've gone through, the lack of healthcare for some of our communities. And I think this is a really good opportunity to see if there is systemically some misgivings about providing care for people of color. Anyways, I don't mean to rain on anybody's parade, because I absolutely will be voting yes on this, and I think this is wonderful. Hopefully this is something that our state can fund and that this can come to fruition. I want to make sure that all people of color, as we are moving towards equity and race-based policies, that we take those two areas of concern into mind when we are supporting some of these bills that are coming across our desk. So once again, thank you so much, Councilmember Carrasco, and Assemblymember Calra. I'm sure that he's busy doing some other things, but my thanks out. I send him thanks out into the universe for leading this effort. Anyways, thank you so much.
Thank you, Councilmember. Councilmember Davis.
Thank you. Just want to make sure I understand exactly what you said before, Alexandria. There have been no additional details on a funding source for this bill. Is that correct?
Yes, that's correct.
And is there a cost estimate for this?
No, there's currently no cost estimate.
Okay. And then my understanding, I maybe don't remember the calendar correctly, but is the legislature in session right now?
No, the legislature is not in session. They don't reconvene until January. And so that's one of the other reasons why we haven't seen amendments, because they can't put amendments into print until the legislature reconvenes. And so the first step right now is this is sort of the busy period in the fall where people are readying, lawmakers are readying their bills to reintroduce at the start of the year, which is why there's sort of the advocacy effort that's sort of happening and that's underway at the moment.
And normally, so I got caught on a process question when I put in a memo about opposing SB 9 and 10 when the legislature was in session, and my colleagues who are so eager to approve this item and move it on to council didn't even second my motion. So I'm a little bit confused about how this process might be different than what we were going through at the time, which was a bill that was, which were bills that were active and not yet passed. So this bill is inactive and the legislature is not even in session. So I'm not clear on why we should take action outside the regular process. And I'm interested, Alexandria, for you to let us know, what is the normal process that you go through for us between now and when the legislature will come back to session?
So in terms of the process that we're sort of going through right now to prepare for the next session, is that we are evaluating a number of different bills. So there is a process right now sort of looking at the city's legislative program and the policies that it supports and sort of adding and refining that. We're also hearing from legislative offices about the bills from within our delegation and more broadly that they're planning on reintroducing next year. So that's one of, we've actually heard from Assemblymember Calra's office on AB 1400. So that's one of the bills that we've heard about. And so that's kind of the process that we go through in terms of preparing for the next session. You know, I can't speak to specifically how we decide whether or not, especially in terms of the bill being inactive versus active. I think that, you know, I think the thought is that the bill was active earlier this year, that it had already gone through rules, and that the assembly member was planning to reintroduce it. And so that was the reason why, or the reasoning for bringing it back to rules to make a determination on whether or not to take a position.
Okay, thank you. I appreciate that. So I'm concerned that this bill has no new information about a funding source or about total costs. However, I'm not interested in being told another time that my bill is going to be out of order and out of process. So in the spirit of camaraderie, I will vote to move this forward to the full council. and hope that my colleagues in the future would do something the same. I will tell you though, Councilmember Carrasco, that the issues of cost are very concerning to me, and I'm unlikely to vote for it in full council as a result of that, because until we know more about what the costs and what the funding source would be. Thank you.
Councilmember Carrasco, did you want to directly address Councilmember Davis's question?
Yes, thank you so much. And I've asked the exact same questions, although I will tell you that I think it's more costly to have sick people and people who don't have insurance or who are not using it, or not using it correctly and not getting preventative care. We've seen that for many folks who don't have insurance, their primary doctor and their primary care is the emergency room. And so at the end of the day, we pay for that anyway. So I hope that, there was a caller that said it most succinctly and eloquently. We're the 5th largest power in the entire world. To me, I know that this is a values vote at the end of the day. And we put our money where our values are. For me, I saw the devastation that COVID, the way that COVID just ravished my community, the district. And I want to remind everybody, I was elected by District 5, but these are our residents. They belong to each and every one of us, and we represent them. And so I understand the concerns, Councilmember Davis. We'll have that discussion further in a couple of weeks if this moves forward at City Council. But I contend, and so do many other economists, that having the emergency room as your primary doctor is a lot more expensive than providing coverage for our families and being able to have that preventative care, as well as being able to have access to good quality health care for the residents that currently do not have it. They do not have it. And so I know that that's difficult sometimes to understand when you don't represent, these really, really underserved communities, but I hope that we can provide those stats and those numbers for you and convince you to support AB 1400.
Thank you, Councilmember. Councilmember Cohen?
Yeah, and I had extensive conversations with Assemblymember Collar back in the spring, and I think I talked about that at the spring meeting. I asked him about how to get from A to B, and as he said, it's not about getting from A to B, it's about getting from more like A to C. There's a lot of steps that have to happen between this bill coming forward and implementation. And the plan in this bill is a multi-year transition period that with a lot of details we worked out in committee. And I think supporting single payer doesn't mean that we're supporting a specific funding mechanism. What we do know, and even simpler than what Councilmember Carrasco said, the current system is more expensive than single payer, period. That there's no doubt about that. So we know the costs are lower of this bill when it's fully implemented. The real challenge, and one that is hard to answer at this point, is how you transition, given the infrastructure that's in place to support the current system, to a single payer system, which will be cheaper in the long run, and which will be actually better for business, because as one caller pointed out, it's always been surprising to me that businesses feel like that they have to provide the service of hiring large HR staffs to implement health insurance policies for their employees. It's a very costly thing for businesses. It's also a costly thing for medical providers who have entire staffs of people in their offices whose job it is to figure out all the policies and file paperwork to all the different insurance companies that they have to deal with, instead of having a single place to go. So there are clearly cost efficiencies in the system. Where the money will come from is actually pretty straightforward because of where the money comes from now. The question really is how you transition from all those people working in the area of health insurance companies, HR in businesses, and in billing, and all of these paramedical practices, and repurpose those people to a system that's single payer. And that process will have to be worked out by the legislature with a multi-year transition period that will slowly get us from A to Z. But I trust that the legislature isn't going to, I know based on conversations I've had with members of the legislature that they understand the complexities of that, and that they will work to solve that as part of passing the bill. But I do think it's important for us to say the current system is broken. What we get from single payer is more straightforward and more cost effective. And let's ask the legislature to get us there. And that's really what this vote would be for me. It's not about any specific details of how that would be done.
Thank you, Councilmember Carrasco. Also, thank you for your leadership in moving this forward. I have to trying to be consistent, and as everybody knows and hears, I'm a big process person, and I was, before even Councilmember Davis spoke, when my turn came around to speak, I was actually going to raise that as an example of I did not support her memo to move forward with SB 9 and 10. And the reason why is because it didn't follow the normal process. And that process is for us to direct Alex and her team to do a thorough analysis and then bring that back to us. And then we would move it forward to council. I'm a product of the public school system, so I can count. Well, hopefully I can count. And so I know there's enough votes to move this forward, but I just can't support it. Again, just to be consistent and just to follow process. But I'm looking forward to a thorough and extensive analysis, Alex, from your team. And I'm looking forward to a robust debate and discussion on this item. So we have a motion and a second. There's no other. Go ahead, Councilmember Davis.
Thanks. I would like to ask Alex if you think that October 26th is the correct date to come back and you can do a robust analysis and presentation, or if it needs to be a different time, because I do think this is, I don't want this to be an item that just shows up on consent. We do need to have a discussion about it.
So I think that, let me jump in on that. I think the way we support legislation, it takes on a variety of different forms. One of the things I know that we've done in the past with when we haven't had all the data or analysis is take support and concept positions. I would just say, obviously, a lot needs to happen with this piece of legislation, as Councilmember Cohen pointed out. So we will be coming forward in November with the intergovernmental relations work plan on what happened in the last year and kind of a look forward into what we're prioritizing for the next year. So that is another option to discuss this piece of legislation at that hearing and kind of prioritizing it with the existing work plan and the other work that you've given to IGR. But as Alex pointed out, a lot of our analysis is going to be dependent on the analysis that comes out of Sacramento, specifically Legislative Analyst's Office. And then the committee process in Sacramento is fairly robust, and committee consultants will kind of bear a lot of the responsibility for that analysis, and that is supposed to be impartial. And so we rely on that analysis when we bring things forward to you. So if it's some of the data, a deep dive into the mechanics of the bill, January would be a much better time frame. But if it's a support and concept and really talking more about the single payer system versus the implementation of the bill, we can have that discussion in November when we bring forward the IGR report and prioritize it within the existing work program.
Any other questions?
So as the maker of the motion, I'm willing to amend my motion to have it brought forward at the same time as the IGR report on the agenda in November.
Is the seconder okay with that?
I think that was Councilmember Reyes.
I don't remember. Councilmember Reyes, are you okay with it?
Sure.
Okay. All right. Is there anything else on that? If not, Yasmin?
Davis?
Yes.
Cohen?
Aye.
Cadenas?
Yes.
Morales?
Yes.
And Jones?
No.
Thank you.
All right. Next item is the water shortage declaration. And we're going to go to the public first. And Brian?
Hello, thank you for bringing this up. And I think it's important that we do that. I know I've already cut back to 15, 20%. And I'm hoping that you can work with the water district. I find the water district and those other creatures at those other people at the California Public Utilities Commission, and I shouldn't have said that's not a problem. They're just very frustrating. I'm hoping in some way during this discussion, we can find a way for everybody to work together. The city works really well with the people in the city, but the water district, they don't like public comment. That's made for very sure. They don't like the city to say anything. They're all experts and we're not, which is fine, but they don't explain anything. And it seems like a lot of the water shortage issues have come up because of communication issues. Granted that we can't make it rain. Maybe eventually we will be able to, but not now. So I hope that, I don't know how to word it right, but I hope Vice Mayor, you get what I mean. I appreciate what the council's leadership on this has been. I wish the district and especially the California Public Utilities Commission was like you when it comes to running a meeting. Thank you.
Thank you. Tessa?
Thank you. Well, yes, we definitely need to deal with our water shortage. As we can see, the rivers are all down. Even our hydroelectric is down because of that. So our electricity is being affected by our drought. And so it's already started. I mean, the intensification of how low all of our reserves are. And if we don't get rain this year, which is a possibility, we're going to be in a very bad place. But we really need to be creating the resiliency of our community. It's part of what needs to happen in our neighborhoods, that we do need resiliency and to learn to capture our water, to figure out how to do that. So we need to have trainings in our community and how our government can support us in doing that, which with the water districts are providing free or reduced costs for water capture and cisterns and cistern building. But I think that as a community is where we need to build our resiliency and how our neighborhoods can become stronger, and not only for resiliency, but even for our political power to influence what is happening in our neighborhoods. So I think this needs to be a new meme in our communities, is to really build our resiliency and gather together as a network. Like that was what the Grange movement was back in the late 1800s, was coalescing people to work together. And actually their whole mission was to become patrons of husbandry. And that's where we need to go away from. We need food instead of lawns. So we have to change our watering practices so that we have more resiliency instead of the lawns that don't provide food. So we really have to prioritize all of our lands to be productive in terms of our water use as well.
Thank you. Blair?
Hi, thank you. I'll try to be quick and simple with this item. Just a reminder from myself with these water issues, the issue of subsidy at the local level has been really important to be learning about. That I think, with the housing issues, that we've been making strides to make it a more open, accessible, understandable process with the public, that we've got a ton of new subsidy money coming in. With that, with these water issues, I hope we can talk to local community, how they can be given breaks, and it works with community energy that way itself, garbage issues. And overall, good luck in how we can. We're going through a next couple of years are going to be pretty difficult. Good luck how we can talk about these things. Thank you.
Thank you. That's the end of public comments, bringing it back to the committee. And Councilmember Davis.
Thank you. So we put this memo forward because we have a number of organizations that have to do with water in our city, and we wanted to provide some consistency for all of our residents and the ability to communicate effectively with them about what options are available to them to help conserve water, which is what we so desperately need. And I see that Carrie and Jeff are here, and I wanted to give them an opportunity to weigh in, and also I'll move the memo.
Second.
All right. Carrie or Jeff, you want to take advantage of that invitation to weigh in or not? Your call.
I can jump in, Vice Mayor first.
Okay.
Yes, but we do have Carrie. We do have Carrie and Jeff on if there's any subject matter questions, as they are the experts on this.
Right. So you're going to speak to the early consideration form.
Yes, staff does have an early consideration form out, so would ask the Rules Committee actually, in addition to the memo, actually move the early consideration form. A great majority of it is green lit, as we can absorb some of that work, but there are workload and capacity issues associated with some of them that would require additional analysis or be better served in a conversation around future roadmap or budget process. So I'd ask you to include the early consideration form as well.
Sorry about that. Apparently my Granicus wasn't updated. I didn't see it. So yes, I will include that.
Thank you.
And yes, that's fine.
All right, Councilmember Perales.
Yeah, I just appreciate staff, submitting that early consideration form and recognizing a lot of what we asked for, right? We're curious as well, the workload on what that takes. And so, again, appreciate seeing that and seeing what is greenlit and what may need a little bit more discussion and determining resources or prioritization. I think inevitably we know this is a priority and needs to be a priority in the immediate coming months and the year ahead, especially if we end up with another drought year. It's really looking bleak for our for our community here locally, especially with what we're facing because of our reservoir being empty at the moment. And so appreciate the work here, and I don't think there was anybody from the mayor's team to speak on the item, but happy to support it as well moving forward. Thanks.
Thank you, Council Member Lee. So on the early consideration, some of the items are green, some are yellow. On the yellow items, typically, how would we handle those? Process speaking.
Yeah, so it depends on the item. Actually, we handle it on a case-by-case basis. So we usually refer those into priority setting, which is really the roadmap process now. If it is a budgetary issue, we will refer it to the budget process. And so staff tracks those referrals and we bring those forward as such. Other times, we've played around with the language at the Rules Committee to see if we can turn yellow to green in the past. But typically, they're referred into the budget process or the roadmap process. And then the administration has a responsibility to bring those forward in those processes.
Okay, so would that happen here in rules, or we would move the whole memo to council and then make that determination?
No, the Rules Committee has the authority to dictate this work, especially as we're greenlighting it. So there's agreement with staff, and so the next time that you would see some of this, or the whole council would see this, is when we start bringing some of these greenlit items back to the council. But there's no direction in here that the actual direction needs to be approved by the council, since it is part of existing workload.
Okay, so the maker of the motion has the discretion to either direct those yellow items to priority setting or just continue to move them on to council. And I know that there was item 4, which you feel if there's just one modification to the memo that it could go from yellow to green?
Sure, and I'd ask Carrie or Jeff to jump in, but recommendation 4 is to conduct and report on an internal review of city departments to ensure that every department has exceeded the goal of 15% water reduction consumption. And it is actually, it doesn't sound complicated, but tracking that is actually a bit more complicated the way we're structured. And so if we're tracking that on a citywide basis, just the city as a whole, we can change that to a green light right now. Yes.
All right.
Jeff,
let's
I don't
change
know.
it Citywide.
All right. Been a modification. Is that okay with the seconder?
Yes.
All right. Move something from yellow to green. All right. I don't see any other hands raised. So Yasmin?
Davis,
Yes.
Cohen. Cohen,
Aye, sorry.
Arenas, Morales,
Yes.
and Jones.
Yes.
Thank you.
Thank you. On to open forum. Go ahead, Blair.
Hi, thank you. Blair Beekman here. Thanks for the meeting today. It was very interesting. I guess I wanted to first apologize a bit for I got a bit overheated last week at Smart Cities Committee. I had points to make. You know, we're going through this. I think I want a bit more respect about how I am addressed at public comment time. But at the same time, I need to practice just the better practices of the process, and I want to respect that. I hope we can work that out. I'm sorry I got upset. There were a few items from that last week I wanted to mention from the accounting report. You know, I just wanted to remind that cybersecurity practices that Joe Roy will be working on are, to me, it doesn't have to be an effort of warfare and continual war. It's, you know, we can really address the ideas of peace in cybersecurity practices, the same as we are with other data collection issues of the city and open democracy. And those are the practices that can help people understand what is our good practices and rules of the road. I'm really sorry for there was community equity items about digital equity items that I'm really sorry. I wanted to offer my important words to learn how to work, you know, hand in hand with open public policies and digital equity ideas, and just to always note that it's an important combination we work for in the future, and I don't want to hurt that. And to the mayor's issues of AI issues, that we have to be, you know, as I've been trying to say, real open-minded and open-hearted with caring of democratic practices and good equity ideas. Good luck with that, and thanks for addressing Tessa's issues today about subcommittee things, and thank you.
Thank you. Brian.
Yeah, oh, I forgot, Brian Darby, thank you. And I sort of what I was speaking about is communication. At every council meeting, sometimes the planning commission, the other commissions, people say reach out through emails, faxes, phone, you know, in you know, like public comment here. And I have to sort of qualify Blair too, is I've made several calls to 6, to 1, to 8, and I think to 10, I'm not sure that, and no response. And I know the staff is busy. We hear that all the time. And I'm not saying that to belittle staff, because they work very hard, as do you, ladies and gentlemen. But so do we. And we take that extra time to call. We take the extra time to write emails. We take extra time to point out situations that we see extremely dangerous in the city. For instance, over by the Santana West, the crosswalk on Olin Avenue is blocked. So people have to cross on the other side. There's no timed crosswalk there. I almost saw 4 kids get hit at there because somebody was going fast and blew through the light, which is another thing. Winchester and Stevens Creek. Winchester and Monroe. I'm not Winchester, Stevens Creek and Monroe. Hamilton and Meridian. People blow through lights all the time. And I mean all the time. People almost get hit all the time. And I understand that you can't have a policeman on every corner. If I remember right, there's only 20 officers that do traffic enforcement. And my point is, I don't know how to reach out anymore. I can come to these meetings, I can talk, and I mean, people listen, it's appreciated, but we don't hear anything back, you know, and it's supposed to be a two-way street. And if you can't even return call, or if it's not easy to return calls, 2 minutes is very hard to explain something in open forum. And the note and file is also very frustrating. That means it just got stuff in the back. I don't even know what it's used for, to be honest. Thank you.
Thank you, Brian. You know how to get a hold of me directly, so reach out to me. I can follow up with you. Tessa? Go ahead, Tessa.
Okay, yeah, I got it, but I don't see, oh, there it is. 2 minutes, thank you. All right, well, thank you, Vice Mayor, for even responding that he has your personal phone number. I guess I would like your personal phone number too. And you know what Brian, thank you, Brian, we love you, we appreciate you, you know, is saying is what I've been saying. I call, or, you know, 1 through 10, you know, and and the city manager's office and the clerk's office, you know, and the thing is that, you know, the messages we get is, we're out because of COVID. We'll get back to you when we're back in the office. We're back at City Hall. You know, yeah, that will never come. I don't even want you to be back in City Hall. It's important that you stay home and work at home. I understand that. But why? And it is the city manager. So I'm pointing this to the city manager, is that the city manager is responsible, that they could not figure out how to get those phones transferred to your workplace at home. You know, this is the city of, you know, the Silicon Valley. Every other vendor that I work with is working at home and it's transferred voice over IP, and yet you don't do that. And we know why you don't do that, because you don't want to hear from us. You don't want to hear from us. And you know, what did it take? 20 calls it took of Bloom Energy to have it pass, that we would pass that gas, that we put gas into our environmental, you know, supposedly fossil fuel free, you know, clean San Jose. We, you know, it took them even 20 calls to get to you, but they got to you. They got to you. We don't get to you. You don't respond. And that's why we're in a crisis that we're in, because we're not building the resiliency that we need. And I've been talking to you about that we need resiliency, and that we need to have transformational change. And transformational change means you take that bus depot that has caused the disease and disability in my neighborhood, the diesel bus depot, it's across from my home, and you turn it into a garden and turn it into the Valley of Heart's Delight again. That's called transformational change. And that's how we will survive as a species. But you're not listening. And it's.
Thank you. That is the last public speaker. So this meeting is adjourned. Take care, everyone.